It feels like it's everywhere lately, doesn't it? These really alarming stories about seemingly fit, healthy people having heart attacks right there in the gym. It's enough to make you second guess your own workout. Well, today, we're going to cut through that fear. Drawing on insights from experts like nutritionist Vivek Sengar, we're going to get to the bottom of what's really going on.
Yeah, this has become a really unsettlingly common headline. And look, if saying that makes you a little nervous before you hit the gym, you are definitely not alone. The concern is real. But to really protect ourselves, we have to understand what's actually happening.
So let's ask the big question. We see these terrible events happen at the gym, so it's easy to blame the gym. But is the workout itself the villain here? Or is it just exposing something that was already lurking beneath the surface? That's what we're here to figure out.
Here's how we're going to break it down. First, we'll pinpoint the real culprit. Then, we'll look at who is most at risk. After that, I'll give you a practical safety checklist you can actually use. And finally, we'll talk about how you can get back to exercising with total confidence. Okay, this is maybe the single most important idea to grasp. For the vast majority of these cases, the exercise itself is not the root cause. The workout is simply the trigger for a pre-existing and often hidden condition. And that distinction is absolutely critical. This is honestly the perfect way to think about it. An intense workout puts your body under stress. Your heart rate goes up, your blood pressure spikes. Now, if your heart and arteries are healthy, they can handle that no problem. But if there's an underlying issue, that stress is what can pull the trigger on a major cardiac event. Now, check this out, because this busts a huge myth. We all tend to picture a heart attack coming from an artery that's like 90% clogged. But what cardiologists are finding is that in the gym, it's often these smaller 30% blockages, the ones that are soft and unstable, that are the most likely to rupture under sudden pressure. And this is a really sobering statistic. In half of these cases, there are no classic warning signs. No crushing chest pain, no pain down the arm. The very first symptom is the collapse itself. And that's exactly why understanding your hidden risk factors is so important. So what's actually happening on a mechanical level? It's something called shear stress. Here's an easy way to picture it. Imagine a fire hose suddenly blasting water at a weak spot on a brick wall. That sudden, powerful rush of blood from intense exercise creates friction inside your artery. If the artery wall is weak or has some unstable plaque, that force can literally tear it, causing a clot to form almost instantly. Okay, so now that we get the what, let's talk about the who. When doctors look at these cases, they generally see two very distinct groups of people who are at a higher risk. Figuring out which group you might fall into is a huge first step towards staying safe. For the younger crowd, people under 40, the danger is often from silent, undiagnosed genetic issues. Things like an abnormally thick heart muscle or an electrical problem they were born with. But for those over 40, the risk profile completely shifts. It becomes about lifestyle factors, things like diabetes, high blood pressure, or high cholesterol that may have been slowly developing for years. All right, we understand the problem. Now for the good part, the solution. The point of all this is not to scare you away from the gym. It's to arm you with a clear, actionable plan to make your workouts as safe as they can possibly be. Listen, if you take one thing away from this, let it be this. A simple resting ECG is often not enough. That just shows what your heart's doing while you're lying still. You need to see how it performs under stress. A treadmill test, an echo to look at the heart structure, and full blood work. That gives you the real picture of your heart's health. So once you get the all clear, you need to know your limits. And thankfully, there's a really simple formula for that. Just take the number 220 and subtract your age. That number is your maximum heart rate, the absolute ceiling your heart should hit during a workout. Don't guess, calculate it. So what does that formula actually mean when you're on the treadmill? Let's use a 50-year-old as an example. Their max heart rate is 170. The sweet spot, the safe and effective zone for a good cardio workout, is between 100 and 120 beats per minute. Pushing it past 145 and into that danger zone consistently, that's where the risk really starts to climb. We have got to get rid of this no pain, no gain mindset when it comes to heart health. Your body gives you clear signals when something is wrong. And it might not be a sharp pain. It could feel like a weird heaviness or burning or even just bad indigestion. If you feel any of these things, you stop, period. And then there are these hidden dangers you might not even think about. Not drinking enough water actually thickens your blood, making your heart pump way harder. Holding your breath during a super heavy lift,
That causes a massive, immediate spike in blood pressure. And believe it or not, your blood is naturally thicker in the early morning, so going all out from 6 to 10 a.m. can be a little riskier. Now, if a problem is found during a checkup, it's good to know what the options look like. This table gives a quick comparison. You have angioplasty and bypass, which are major procedures for acute problems. But there are also non-invasive options out there, like EECP therapy, which can help manage chronic conditions without surgery by improving blood flow.
So let's bring all of this together. The goal here is not to create fear. It's the opposite. It's about empowerment, because with the right knowledge, you can absolutely make the gym a safe, powerful, and life-changing part of your routine.
Let's circle all the way back to the main point. The danger isn't walking or lifting or cycling. The danger is the intensity. And here's a super simple rule of thumb, the talk test. If you can still hold a conversation while you're exercising, you are almost certainly in a safe heart rate zone. Now, even if you do everything right, emergencies can still happen. But there is one simple thing you can do, one question you can ask that can increase the chance of survival for everyone in that gym by a whopping 70%. That's it. That's the question. Before you even sign up, walk in and ask the staff, do you have an AED machine? That's an automated external defibrillator. Having one on site and having staff who know how to use it is the single biggest factor in surviving a cardiac arrest. It should be a non-negotiable.
Because in the end, you can have the fanciest sneakers, the best personal trainer, and the safest gym in the world, but the single most important piece of equipment you will ever bring through those doors is your own body. The real question is, are you listening to it?